too early?
It's too early. We don't know what the twists and turns of this pandemic, but we do know at this stage that we can start to learn the lessons from what we got right in this pandemic, the things we changed and then got right, and the things that we did wrong. And I think it's important to learn, not just for the next pandemic, but even how we handle the twists and turns that can happen with COVID-19.
How wrong did we get it? And should we, at the time, was it even possible to understand that we were getting it wrong?
That is such a great question. It was very difficult at the time. You think back, we'd just come out of bushfires. We hear about this coronavirus. We don't know what it is. There's a swirling fog of uncertainty. And so it was very difficult to make decisions. But looking back, we can see that certain things we got very well. The speed with which we came in to give large amounts of financial support was really good. The trust we placed in public health officials, that was good. But we can also, looking back, see that even now we got certain things wrong, and that's our lessons for the future, both handling perhaps the rest of this pandemic and whatever the next health crisis is.
So what were the things that we got wrong, the worst decisions?
I think the single biggest failure was not sufficiently planning at the start for the fault lines in society, those who are disadvantaged, those who are vulnerable. We knew, in a sense, who they would be. People from low socioeconomic groups, people who are on the wrong side of the digital divide, women, migrants who are here from non-English speaking backgrounds, our First Nations. Now, here's the tragedy. Whatever we say about how well we handled this, if you look at the outcomes in terms of mortality rates, you can see we didn't get it wrong. So right at the start, this next time, we need to put those fault lines first and foremost in mind if we're going to handle a national pandemic correctly.
Some of the recommendations you made before, like transferring COVID-affected people from aged care homes to hospitals, keeping international students in the country and having less lockdowns, would these things not have completely overwhelmed the health system in the way that we're seeing now with the hospital system?
That's why initially we think things like lockdowns and border closures were important. They're important because they buy you time. You can discover more about the epidemic. You can access vaccines. You can make sure that hospitals are prepared and you've got your ICUs. We can get in the protective equipment. So that's how you use lockdowns. You buy yourself time. The mistake we think we made is that we didn't use those lockdowns sufficiently to set up contact tracing, to make sure we had quarantine arrangements in place, to make sure we had ample supplies of vaccination and rats. That's what we've got to do next time. Lockdowns are part, but they can't be, in a sense, the key way of dealing with a health crisis.
Professor, who do you think should be held responsible for these gaps and failures in terms of policy making that eroded trust for the public?
In a real sense, we are all responsible. I cannot say to you with my hand on my heart that 2 years ago, in that swirling fog of uncertainty, I would have made different decisions or given different advice. That's not the point. What I can say now, looking back over that 2 years, is that we can see things that we did get wrong. The fact that we didn't extend JobKeeper to temporary migrant workers, for example, or that we shut down school systems too fast, or that we could have done better in meeting the needs of elder people in residential aged care communities. Right now, I can say that we got some of that wrong, but the key is that we've learned the lesson for the next time, or even for the rest of this pandemic.
The review found that there was overreach. What were some of the key examples that you saw of that overreach?
So lockdowns are an important first measure while you're learning about the pandemic and you're preparing to deal with it. They are a good first stop measure. Most societies use them, and we should have used them, lockdowns and border closures. But as I say, you use them for a purpose to prepare. We think in many instances, because we didn't access vaccines fast enough or rat tests fast enough, that too often we had to extend lockdowns beyond what would otherwise have been necessary.
You've mentioned the impact on school students, even despite the fact that we are bouncing back from COVID. Do you think that these long-term impacts could have been prevented if the school systems weren't shut down in the way they were?
You know, so often in a crisis, and I understand this, you are making decisions when you don't know everything, and you're making short-term decisions. What we now know is that there have come significant costs. We can see it already from shutting down schools. And it's not just educational disruption or the impact on the economy because parents had to stay home, or the increased pressure on parents, and particularly I'd have to say mums. We can already see it in terms of the stress and the anxiety and the, frankly, mental ill health of many young people they've not just been shut out of school, if you think about it, they've been shut out of the normal life that you have at 15 and 16 and 17 years of age. Now, the evidence is that can have longer-term consequences, which we now need to deal with. So sometimes we make decisions for the short term without looking enough and trading off what the medium to long-term impacts are going to be.
Given what you know now, how do you feel we're handling the cases of long COVID? Because it seems that there are tens of thousands, if not hundreds of thousands of people still suffering the effects. Are we dealing with that adequately?
Long COVID, I think, is a wonderful example where evidence is still appearing, where we don't know quite the impact of long COVID. And as we do know more, we may have to change our policies again as more evidence comes in. The important thing is that we respond to evidence. What is the evidence on which governments are making decisions? What is the evidence on which governments are changing decisions? And here's the thing, we need to make that evidence transparent. We need to put it out to the public. We need to have that evidence interrogated. We already know from the pandemic that different epidemiologists have different views. We need to have these things, argued out. And the way is to make sure that when governments make the decisions, the evidence on which they're making it is transparent and available.
None of the people on the panel today were registered medical professionals. Do you think you've given significant weight and input from the medical community in this review?
Yes, I think we have. At first, we were thinking of doing that. The difficulty is, of course, is that, as I say, there are very different views. Ask any epidemiologist, any of our institutes, and you'll get different views. And this was not a report we were going to write on epidemiology. This was a report on how we responded to a pandemic. Of course, many, many of those that we spoke to on a confidential basis were very senior levels in public health.
Did the way we respond to COVID become too political? We saw during those long lockdowns, premiers holding press conferences, often for an hour to 2 hours, answering every question that news outlets were taking live. Did that help? Did it hinder? Did it fuel anxiety? Should have that time been better spent?
Sometimes that helped and sometimes it hindered. It helped, of course, when all leaders came out of a national cabinet and had the same message. I think many Australians who thought, well, the one advantage we can get from a crisis is that we'll come together as a nation and the national cabinet will give us a national response. And there was hope. I think over time people did believe, well, politics is reversing to as normal, and you come out of a national cabinet and then each premier or chief minister gives a slightly different story. I think there was lots of long press conferences and lots of information, but what our report makes clear is that is not the same as effective communication. And many people, by the end, didn't actually fully understand what was being required of them.
On the effectiveness of shutting down schools, was it not a key argument that it was less about kids contracting the virus as they were less at risk, but getting the virus and taking it home to their vulnerable loved ones? And that's the link that we were trying to interrupt.
There were lots of concerns about keeping schools open, and particularly about social distancing. Now, what probably wasn't taken into sufficient account right at the start were both the educational and the economic and the mental health consequences of that decision. But we can understand why initially you may want to shut down schools. I think it was always wrong to shut down whole school systems. It was much better to shut down schools when incidents occurred. You know, we knew at the beginning, and we know even more now, that younger people, on the whole, are less likely to get COVID and are less likely to suffer severely. We know now that, in fact, schools are relatively low environments for transmission. Knowing that now, I think you would do what we are actually doing with schools today, and on the whole, keeping them running and realising that we need to do so in a way which provides a safe environment both for teachers and for students.
Was it also wrong to more severely shut down parts of cities? I'm talking about southwest and western Sydney, and entire apartment blocks, as we saw in Melbourne.
It is important that you respond, and if there are particular areas where COVID is raging, then it may be good policy to shut down those areas. But the danger of doing that is it can undermine public trust, and people in Bankstown think they're being unfairly treated compared with people in Bondi. So you have to have very clear messaging of why you're doing it and the purpose for what you're doing it, and working at the community level. If there's a key message I take from this, is that you're trying to deal with a national pandemic, but at times you have to deal with it by dealing much more directly with local governments and local communities and community leaders and business leaders, not just in making those decisions, but in implementing and communicating those decisions.
Can you give any more specific examples of lockdowns that were politicised, or certain elements of lockdown that were politicised?
The key argument about lockdowns and closures becoming political is when they are continued beyond when they are necessary to give protection. In other words, once, as now, we think sufficient number of Australians are vaccinated and we have avoided the horrendous pressures on hospitals, at that stage we should have been making decisions to cease border closures or to move away from lockdowns. Too often we didn't do that, and too often the periods lasted because we hadn't done what we needed to do in the lockdown period. If we can do that, we will need to use lockdowns and border closures less in the future. And remember, they are a very strong, even brutal response. We've got to make sure that when we do that, people understand why we're doing it, how long we think we're going to have to do that for, what we've got to do, and to be able to convey why those decisions are going to be made. One of the problems with border closures was people not knowing, well, who was able to move overseas and come back? Was it on business grounds? Was it on personal grounds? Again, there was that lack of transparency about how governments were making those decisions.
So did the Sydney lockdown last year continue for too long, in your opinion?
I'm not going to go to any particular lockdown or closure. I'll continue to repeat that it is clear that we didn't use those lockdown and closures as we should. That was our opportunity to plan. That was our opportunity to get vaccines. That was our opportunity to set up contract tracing, etc. We all know that. If we had used that time better, lockdowns could have been shorter, border closures should have been shorter.
Professor, do you think the inequalities that you marked in your report along race, class, gender, they widened because of the policy responses in the last 2 years?
Look, I think it is clear that governments and their public services recognise how they have to do more to increase citizen engagement at times when there's not a crisis, to be able to talk better with business and unions and community organisations. We should be doing that now. It is even more important at a time of crisis that we're able to do so, because otherwise those fault lines that you talk about, fault lines of income, fault lines of age, fault lines of ethnicity and race, they will come to the surface. They did come to the surface. That's why it is absolutely crucial that as we prepare for the next health crisis, as we prepare to see out this pandemic, that we really focus on those groups who are vulnerable and are most likely to be most adversely impacted. I think that's probably enough.
Do you think...
That'll be my last one, okay?
Do you think the National Cabinet worked as a functioning body, and moving forward, what should the framework look like?
I think that National Cabinet was a significant improvement on what had gone before, which was COAG, which, as you may know, is often seen as an instrument, an institution where ideas go to die. So I think National Cabinet was something different. People had such hope of National Cabinet, of thinking that we could bring together our political leaders for a national response. People were hopeful that this crisis would actually create that. And I'd have to say that as time went on, they became disillusioned. I am very pleased that the government is continuing now to run National Cabinet during more normal times, and hopefully that can build its credibility in trying to make decisions that go beyond individual jurisdictions. If I had one hope, it would be that every political leader in Australia says to their public services, we want you, we authorise you to work with public servants in other jurisdictions in trying to bring together whole of government national responses to key issues. Thanks so much. Really appreciate it. Good.